In this podcast episode, Dr. Andrew Huberman welcomes Dr. Shanna Swan, a leading expert in environmental medicine and public health, to discuss the critical issues surrounding hormone health and fertility. Dr. Swan's extensive research focuses on how exposure to various environmental toxins impacts reproductive health, particularly through the lens of endocrine disruptors. Dr. Swan opens the discussion by affirming that environmental toxins, particularly man-made chemicals, significantly affect reproductive health. She emphasizes that these chemicals, often referred to as endocrine disruptors, can interfere with hormonal pathways in both men and women. The implications of these disruptions are profound, leading to declining fertility rates, reduced testosterone levels, and increasing instances of conditions like polycystic ovarian syndrome, PCOS, in women. Dr. Swan's work highlights the urgent need to understand how these toxins affect not only adults, but also developing fetuses and children. The conversation delves into the mechanisms by which these chemicals exert their effects. Dr. Swan explains that endocrine disruptors can mimic or block hormones, leading to a cascade of biological consequences. For instance, exposure to certain phthalates during pregnancy can result in incomplete masculinization of male offspring, a phenomenon she described as the phthalate syndrome. This syndrome is characterized by a range of reproductive anomalies, underscoring the critical importance of monitoring and regulating these chemicals in our environment. One of the most alarming trends discussed is the dramatic decline in fertility rates observed globally. Dr. Swan points out that fertility rates have dropped significantly over the past few decades, with many countries now reporting rates below the replacement level of 2.1 children per woman. This decline is not merely a result of personal choice or lifestyle changes. It is also linked to environmental factors, including exposure to endocrine disruptors. Dr. Swan's research indicates that the decline in sperm counts and fertility is not just a male issue, but affects women as well, with rising rates of infertility and reproductive disorders. Dr. Swan highlights that the decline in fertility is a multifaceted issue, influenced by various social, economic, and environmental factors. While many people attribute the decrease in birth rates to lifestyle choices such as delayed childbearing and increased use of contraception, the role of environmental toxins cannot be overlooked. The conversation emphasized the need for a comprehensive understanding of how these factors interact to shape reproductive health outcomes. Phthalates, a class of chemicals commonly found in plastics, cosmetics, and personal care products, are a focal point of the discussion. Dr. Swan explains that phthalates are known to disrupt hormonal function, particularly testosterone levels in males. Her research has shown that exposure to phthalates during critical developmental windows can lead to significant reproductive health issues, including reduced sperm counts and altered genital development in male offspring. The implications of these findings are profound, as they suggest that phthalate exposure could have lasting effects on male reproductive health. The conversation also touches on the prevalence of phthalates in everyday products, making it challenging for individuals to avoid exposure. Dr. Swan emphasizes the importance of being aware of the products we use daily, particularly those that contain fragrances, as these often harbor phthalates. She encourages listeners to seek out fragrance-free alternatives and to be mindful of the materials used in food packaging and storage. Dr. Swan elaborates on the broader implications of chemical exposure on hormonal health, noting that both men and women are affected by these disruptors. For women, exposure to endocrine disruptors can lead to conditions such as PCOS, which is characterized by hormonal imbalances and can result in infertility. The discussion highlights the need for increased awareness and education about the potential risks associated with everyday products, particularly for women of childbearing age. The conversation also explores the impact of these chemicals on male reproductive health. Dr. Swan points out that declining testosterone levels in men are linked to increased exposure to endocrine disruptors. This decline can lead to a range of health issues, including reduced libido, infertility, and other metabolic disorders. The need for further research into the long-term effects of these chemicals on both male and female reproductive health was emphasized. Throughout the discussion, Dr. Swan stresses the importance of individual agency in making informed health choices. She encourages listeners to take control of their health by being proactive about reducing exposure to harmful chemicals. This includes making conscious decisions about the products they use, the food they consume, and the environments they inhabit. Dr. Swan's message is clear. Individuals have the power to influence their health outcomes by being informed and making intentional choices. Dr. Swan also highlights the role of education in empowering individuals to make better choices. By understanding the potential risks associated with various products and chemicals, people can take steps to minimize their exposure. This proactive approach can lead to improved reproductive health outcomes and overall well-being. Diet is another critical topic of discussion, with Dr. Swan emphasizing the importance of consuming whole, unprocessed foods. She notes that many processed foods contain additives and preservatives that can disrupt hormonal balance. By opting for organic produce and avoiding foods packaged in plastic, individuals can reduce their exposure to harmful chemicals. Dr. Swan encourages listeners to prioritize fresh, whole foods and to be mindful of the sources of their food. The conversation also touches on the impact of diet on fertility. Dr. Swan explains that certain dietary choices can enhance reproductive health, while others can hinder it. For example, diets rich in antioxidants and healthy fats have been shown to support hormonal balance and improve fertility outcomes. Dr. Swan's insights underscore the importance of nutrition in maintaining hormonal health and overall well-being. In addition to diet, lifestyle choices play a significant role in hormonal health. Dr. Swan discusses the importance of regular exercise, adequate sleep, and stress management in maintaining hormonal balance. She notes that chronic stress can lead to hormonal imbalances, which can negatively impact fertility. By adopting a holistic approach to health that includes physical activity, mindfulness, and self-care, individuals can support their hormonal health and improve their overall quality of life. The conversation also highlights the importance of avoiding harmful substances, such as tobacco and excessive alcohol, which can further disrupt hormonal balance. Dr. Swan encourages listeners to be mindful of their lifestyle choices and to prioritize activities that promote well-being and hormonal health. Dr. Swan's work is grounded in rigorous scientific research, and she emphasizes the importance of continued investigation into the effects of endocrine disruptors on reproductive health. She discusses the challenges of conducting research in this field, particularly given the complexity of human biology and the myriad factors that can influence health outcomes. Despite these challenges, she remains committed to advancing our understanding of how environmental toxins impact reproductive health. The conversation underscores the need for collaboration among researchers, policymakers, and public health advocates to address the growing concerns surrounding endocrine disruptors. Dr. Swan's insights highlights the importance of evidence-based policy decisions that prioritize public health and safety. As the discussion draws to a close, Dr. Swan reflects on the future of fertility and hormonal health in the context of increasing environmental challenges. She expresses concern about the long-term implications of declining fertility rates and the potential consequences for future generations. Dr. Swan emphasizes the need for urgent action to address the sources of endocrine disruptors and to promote healthier environments for all. Dr. Swan highlights the critical role of public awareness in addressing the issues surrounding endocrine disruptors and reproductive health. She emphasizes that many people are unaware of the potential risks associated with everyday products and the impact these chemicals can have on their health. By raising awareness and educating the public, we can empower individuals to make informed choices and advocate for safer products and policies. The conversation underscores the need for continued efforts to disseminate information about the dangers of endocrine disruptors and the importance of protecting reproductive health. Throughout the discussion, Dr. Swan emphasizes the importance of policy in addressing the challenges posed by endocrine disruptors. She notes that regulatory frameworks play a crucial role in determining which chemicals are allowed in consumer products and how they are used. She calls for stronger regulations to protect public health and to ensure that harmful chemicals are removed from the marketplace. The conversation highlights the need for collaboration between scientists, policymakers, and public health advocates to create a safer environment for all. Dr. Swan's insights underscored the importance of evidence-based policy decisions that prioritize the health and well-being of individuals and communities.